So what happens when an island vet gets a horse call but doesn't specialize in horses? Today, I'm going to show you how I dealt with this exact situation. Remember to hit the subscribe button and to follow me on Instagram for all things Stacia. I'm not an equine vet. However, I've had to learn to become one. And these guys have been my teachers. I've practiced on many different animals over the past 12 years or so at Sugar Mill Veterinary Center. And of course, living on an island presents its own unique challenges. Sometimes the most interesting cases have nothing to do with our expertise. Today, I'm going to walk you through an island horse call, and later share with you one case where a local stable owner contacted me about a young horse who had been impaled on a fence post. St. Croix community loves horses, and we have a horse overpopulation issue here on the island, just like we do with dogs and cats. So there are a lot of horses and no one to take care of them. So many of the horses that I've seen as patients over the years are what we call bush horses. They've been rescued from the bush, which just means rescued from the wild. You drive around the island and you'll see horses tied up to a tree. Sometimes the teenagers on the island like to take a bush horse and have it as a pet until they realize they don't have the resources or the training or the knowledge to properly care for it. The community, and especially the youth, the teenagers that like to race bush horses in the streets of St. Croix, have learned that gelded horses make better racing horses. So along with me educating myself as a veterinarian to do procedures like geldings on bush horses, I've also had the opportunity to work with the community youth and educate the youth and the community at large about the importance of gelding. I've been working with Cruzan Cowgirls Horse Rescue on St. Croix for several years now. They are the only horse rescue historically on the island of St. Croix.
I'm Jennifer Ola, and I started Cruzan Cowgirls here about almost 9 years ago, I think. And it started because I was noticing there was issues with horses on the island. You know, maybe they were tied with ropes around their neck and didn't have water, or they'd be in the sun, or being ridden kind of harshly. There was a couple of times some equine vets were able to come down, and Stacia was able to be there with them, and we picked up some skills from them. And then she's also talked to vets in the States that do equine therapy or equine medicine. You know, has really branched out from just the domestic animal, dog and cat work, to the large animal as far as horses, and helping us, you know, with all of the things that she can.
And during our time together, I've had to do just about everything under the sun that you can imagine to help the horses at Cruzan Cowgirls Horse Rescue, including an emergency surgery on a very special horse named Dragon.
So Dragon was born here at the farm. His mom was a rescue horse that we took in, and when he was about 6 weeks old, we got up in the morning to feed. This was right after the hurricanes. And so everything was kind of crazy, and we had put the horses across in a pasture that we normally don't use, but it was a big, safe place for them to be during the hurricane. And of course, our property had been pretty well destroyed, so we couldn't move them back. Anyhow, that property had a strand of barbed wire at the top, which we normally don't use with horses, but it was the pasture we had available to us. So Dragon, at 6 weeks old, for some reason decided to jump over that fence. And when he went to jump over that fence, he got caught. So as he was on the fence struggling, the fence kind of got wound up into his flank skin. And so when we were able to free him, within a few minutes we noticed a bubble started. Stacia, because she had, you know, done such a good job for us in the past, helping us with some complicated horse issues, I was like, well, looks like we're going to go see Stacia.
I was in the middle of a very busy clinic day at Sugar Mill Veterinary Center, and the next thing I knew, the horse came in on a stretcher, carried by 10 farm hands.
So she looked a little bit nervous, but at the same time, Stacia's got a brave personality, so she said, well, let's try.
I had to think on my feet and reach out to resources off island and online to figure out how I was going to help this horse. It was pouring rain outside, everybody was soaking wet, and this poor horse, who weighed a couple 100 pounds at the time, was completely flat out and had a huge laceration or cut on his abdomen.
And his actual intestines were coming out.
I really was very stressed out and in shock like everyone else. And we had to come up with a plan very quickly. So we immediately got the horse on oxygen and gas anesthetic with a face mask in order to calm him down and start to sedate him. One of my technicians at the time got on the phone with an equine specialist in the States, and we calculated some drug dosages to sedate the horse completely, preparing for abdominal surgery, which I had never done in my lifetime, and most veterinarians will never do that unless they are a specialized horse vet or equine vet. Once I was able to scrub in and prep for surgery, I realized that this was an injury that was really life-threatening. We were able to replace the intestines and start stitching him up. And I realized that there was an area of tissue that was completely gone, ripped out, and we would need to come up with something creative to patch it in order to be able to close the muscle layer of the abdomen as well as the skin layer. We were very fortunate to have some donated supplies from the human hospital on island here. And I remembered that we had a disc-shaped sterile plastic thing. I had no idea what it was, but we retrieved it. Turns out it was something used in dialysis for human patients. So it fit the hole perfectly, and I was able to suture it in place, closing the rip, if you will, or the laceration in the lining of the body wall. We then administered antibiotics, pain medication. I completed suturing or closing the wound in multiple layers. And we crossed our fingers and our toes, because the equine veterinarians who specialize in this in the States, who were on the phone, they said there was less than a 5% chance for this horse to live and survive more than a few days. In the days that followed, we spent numerous hours, day and night, providing critical care to Dragon. He was receiving intravenous or IV fluid therapy, intravenous antibiotics, and pain medication. When horses, regardless of their injuries, stop eating and are not moving around, their gastrointestinal tract can become severely painful. And that's a condition that we call colic. Colic can eventually lead to sepsis, which can lead to death. So when I received a call from Jennifer within 5 days or so, that Dragon was up on his feet, eating and drinking, I was ecstatic. It was like a miracle, honestly. And she was so grateful. We burst into tears on both ends of the phone. I couldn't believe it. I've never done surgery on a horse. I'm not an equine vet. And somehow I had managed to save Dragon's life. So Dragon wasn't out of the woods just yet. We were concerned that as he continued to gain weight, which he was going to do as a young horse, and as he continued to become more active with all of that extra weight, that the stitches holding that object, which was holding his abdomen together in place, might rupture and burst, and we might be back to another emergency situation. I'm very happy to say, all these years later, that that did not happen. We kept him restricted from exercising for several months, and slowly and gradually, our optimism and our comfort level with him having a normal life as an 800-pound horse now increased. And Dragon was able to start running on the beach and living a normal, happy, healthy life without worry of this horrible accident or injury haunting him in the future. As you can see, Dragon is healthy and happy, and I'm so blessed to be part of his story and to be part of his life. Cruzan Cowgirls Horse Rescue is a nonprofit, so they rely on donations from the community and donations from foundations and whatnot to support the care of their horses. And being a nonprofit, I have donated my time to help the horses at Cruzan Cowgirls over the years because we don't have another veterinarian on the island to do so. Have you ever been called to perform a task that's outside of your comfort zone? If so, please let me know in the comments. If you like this video, please remember to subscribe to my channel. Follow me on Instagram at Stacia Island Vet. Thanks so much for watching. I'll see you next time.